thanks Lawrie for agreeing to speak to me today. I was just wondering, can you introduce yourself and say a little bit about your work?
Yeah, okay. I'm Professor Lawrie Elliot and I'm based at Glasgow Caledonian University. I've been doing public health research since about the 90s, from the first HIV epidemic, and my interests are in evaluating public health interventions in drugs, in alcohol, and interestingly sexual health, because back then in the 90s sexual health was part of the whole HIV epidemic, and that's why I've got involved in EPIToPe as well.
Great. So you're also involved in EPIToPe. Can you say a little bit about what EPIToPe is and your role within EPIToPe?
EPIToPe is a huge programme grant, and it's not about whether the new Hep C treatments are effective. It's about how they're delivered. So the idea is that it will be made available, it being the treatment, will be made available through as many community-based services in Dundee, including needle exchange, pharmacies, drugs projects, prison, with the aim of reducing hepatitis C in the drug injecting population in Dundee. And my role as a co-applicant is to lead the qualitative arm of the study, which is around looking at the implementation of all of these particular pathways, as I've just described, and whether they are running the way they should be, but importantly, how they're experienced by those who are on treatment and those who actually refuse treatment. So we're very interested in these questions. Why are we interested in that? Because if it doesn't work here in Dundee, it probably won't work elsewhere, and we want, for the second part of EPIToPe, to expand the rollout to England. So it's key from a number of different questions.
Great. And for this part of the project, we're using a peer research approach, and my understanding is it's not something that you've worked with before. Can you tell me a little bit about how you're feeling about having peer researchers involved in the project?
You're right. I think for me it's a new experience. I think it's a good step that we've taken. Because we're getting true buy-in, in a sense, from those who've been at the coalface in their lives. There've been many, they may well have been experienced the old form of hepatitis C treatment, definitely being involved in drugs services, and they've used drugs, injected drugs in their life. So that brings us, I think, a sense of realism to the research. And secondly, well, I hope that in a sense it's good for the peer researchers as well, to get engaged with this project. But how do I feel about it? Because that was your question. I'm very excited. It's new to me, and I think it's going to be a big learning curve for me as an academic. Because academics, in a sense, I've spent most of my career thinking about sometimes to the public, sometimes to the everyday person, obscure questions, and using obscure methods, and getting qualified researchers to conduct the field work. So this is a brand new experience to me, and so far it's been very rewarding, because it's in a sense, I think personally, professionally, I'm moving from myself as an expert, right, to peer researchers being experts as well. And somehow, and I hope we can achieve this, by the end of this project, I hope that we are all co-producing the research that comes out of it. And if we can do that, and do that as a group, and do that as comfortably as possible, because we've got to sort of put all our professional hats from my side away, and I'm quite sure the peer researchers have got to deal with issues themselves. If we do all that at the end of the day and produce the research that we want, and I'm sure we will, then that'll be really rewarding.
Yeah, that sounds good. And what's your sense of what the peer researchers are bringing to the project, or what you're hoping the impact of having them involved will be?
Life experience. I'm hoping that then improves the uptake into the research. So if any of the treatment recipients, or any of the people who have refused treatment, if they see it's peer researchers that are carrying it out and it helps them engage with the research, that's a number 1+ for us. So there's a lot of barriers possibly removed from that. And I also hope that, as I think I hinted at before, it makes academics like myself more appreciative of some of the positive benefits as well.
Great.
So it's a journey for both of us, I think.
No, that sounds good. Thank you very much.
Okay.